9 alarming signs your blood sugar is high. Maintaining healthy blood sugar levels is crucial for overall well-being. When blood sugar levels become too high, it can lead to serious health complications, including diabetes and cardiovascular diseases. Recognizing the signs of high blood sugar is essential for early intervention and prevention of long-term health issues. In this video, we will explore the alarming signs indicating elevated blood sugar levels and discuss the importance of proactive management. But before we jump into it, don't forget to subscribe to our channel and hit that notification bell so you never miss out on our health tips and insights. What is hyperglycemia? High blood sugar. Hyperglycemia happens when there's too much sugar, glucose, in your blood. It's also called high blood sugar or high blood glucose. This happens when your body has too little insulin, a hormone, or if your body can't use insulin properly, insulin resistance. Hyperglycemia usually means you have diabetes, and people with diabetes can experience hyperglycemia episodes frequently. If you have hyperglycemia that's untreated for long periods of time, it can damage your nerves, blood vessels, tissues, and organs. Severe hyperglycemia can also lead to an acute life-threatening complication called diabetes-related ketoacidosis, especially in people with diabetes who take insulin or people with undiagnosed type 1 diabetes. This requires immediate medical treatment. Meanwhile, keep an eye out for these 9 key warning signs and symptoms that blood sugar is too high, and talk to your doctor about whether you need to adjust your management plan. Number 1, being extra thirsty and having to urinate more than usual. This is a common but not so obvious sign of blood sugar that is too high. Feeling really thirsty and needing to drink more than usual. Excessive urination, known as polyuria, occurs when glucose builds up in your blood and your kidneys begin working harder to get rid of the extra glucose. If your kidneys can't keep up and adjust blood sugar so that it returns to a normal level, the excess sugar is flushed out of your body through urine. You may become dehydrated and get dizzy. Number 2, you're hungrier than usual, but losing weight. Many people with uncontrolled high blood sugar find that they're hungrier than usual, which signals a symptom called polyphagia. Although you're eating more, you may be losing weight for no apparent reason if your blood sugar levels are too high. Since your body is not getting energy from the preferred source, glucose, it has to turn to muscle and fat. When your body starts breaking down muscle and fat for energy, you experience unintentional and unhealthy weight loss. In addition to these changes in weight and appetite, you may notice weakness in your muscles and experience more frequent falls. Number 3, you feel tiredness and fatigue constantly. Fatigue and extreme tiredness are symptoms of uncontrolled blood sugar, the ADA says. Simply put, when your body is not processing insulin properly or it doesn't have sufficient amounts of insulin, the sugar is staying in our blood rather than getting into our cells to be used for energy. Also, frequent urination can lead to dehydration, which identifies as another contributing factor to fatigue. Number 4, you have noticeably blurry vision and frequent headaches. You may notice that your vision isn't as clear as it used to be, and that things may appear a bit blurry. High blood sugar levels can lead to swollen lenses in your eye from fluid leaking in, according to the National Institute of Diabetes and Digestive and Kidney Diseases. This changes the shape of the lens, which makes it unable to properly focus, causing blurred vision. You may also find yourself struggling at work, having difficulty driving, and suffering from frequent headaches. Number 5, you develop sores that tend to heal more slowly than usual. Cuts, scrapes, bruises, and other wounds heal more slowly in the presence of uncontrolled blood sugar, according to the NIDK. Diabetes causes nerve damage and affects circulation, especially in the lower legs and feet, which can delay healing because there isn't enough blood flow to the area. Even minor wounds are more prone to infections, which can become very serious and even result in amputations of the foot. You may notice drainage seeping onto your socks, or an unpleasant smell if you develop a foot ulcer. Number 6, you notice tingling and numbness in your hands or feet. As mentioned, uncontrolled blood sugar can cause nerve damage, also known as diabetic neuropathy. What you may notice is a tingling sensation or even numbness in your hands and feet. Some people experience pain in their hands and feet as well, and the pain is often worse at night. Though neuropathy is most common in people who have had diabetes for a long time, it can occur in anyone with poorly controlled diabetes. Number 7, you're developing blisters, dryness, or other skin changes. Small pieces of extra skin, called skin tags, may form in the creases of skin, especially if you have diabetes and you're trying to find ways to manage your weight. Dark, thick areas of soft skin, called acanthosis nigricans, may form on the back of the neck or hands, armpits, face, or other areas. These can be a sign of insulin resistance. Blisters, infections, dryness, itchiness, discolorations, and abnormalities of the skin can all be warning signs of high blood sugar. Check with your doctor if these skin changes develop. Conditions like acanthosis nigricans can be improved by keeping blood sugar levels in check. Number 8. You're getting yeast infections more often than usual. Hyperglycemia may lead you to get more frequent genital yeast infections. The culprit is often a type of yeast known as Candida albicans, per the ADA. According to the Centers for Disease Control and Prevention, in females the symptoms can include vaginal itching, redness or soreness, pain during sexual intercourse, pain or discomfort during urination, and thick, abnormal vaginal discharge. While yeast infections are common in people who don't have diabetes, having more glucose in your blood puts you at higher risk of getting them. The yeast feeds off the glucose, and if your blood sugar is high, there's more glucose in the urinary tract. Uncircumcised men with hyperglycemia are also at risk. Number 9. Swollen or bleeding gums, which increase your infection risk. Gum disease is a complication of diabetes, notes the NIDDK. It can also make diabetes harder to control, since the body's response to infection is to release more glucose into the bloodstream, according to the ADA. Your saliva contains glucose, and the more it contains, the more there is to feed the bacteria that combine with food in your mouth to form plaque and cause gum disease. Symptoms can include red or inflamed gums at first. If they are unaddressed, they can progress to periodontitis, which can cause your gums to pull away from your teeth, the appearance of pus or ulcers, or even tooth loss. Get your blood sugar under control and see a dental professional to prevent damage to your gums and teeth. When to see a doctor. If you're experiencing one or many of these symptoms, enough for it to raise a mental red flag or affect your life, like because you're too tired to make it through the day, that's a sign that you should talk to a doctor about your concerns. Even if you're not sure that's exactly what's going on, it's still worth having a conversation with your doctor about hyperglycemia and other possible causes behind your symptoms. And that's a wrap for today's video. I hope you found these signs of high blood sugar enlightening and informative. Remember, your health is your wealth, so always stay vigilant and listen to what your body is telling you. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to our channel for more insightful content on health, wellness, and everything in between.